This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday morning in February. It is Heart Month. And with us on Mon Health Talk is Chris Hedio. He's a health coach from the Mon Health Heart and Vascular Center. And Chris, good morning. Thanks for coming on with us. We appreciate your time. Let's start with some personal information about you, where you're from, and what brought you to Mon Health Systems.
All right, so I am actually a native of Fairmont. Still live there. I did my undergrad work at Fairmont State University and post-grad at Life University in Atlanta, Georgia. What brought me to Mon Health really is a family atmosphere and the top-notch care. I'd seen him work with my family for years and, just loved the company as a whole and thought that's where I wanted to be.
Okay, and the type of training you needed to do what you do in helping people?
So I have degrees in exercise physiology. Also worked in medically based wellness for about 12 years, and then moved on to cardiac and pulmonary rehab for about 9 years after that.
Mm-hmm. And again, a native of Fairmont, so you know all about the Mon Health systems, and just take a moment and talk about what that means. Obviously, it's a well-established brand and tradition, and just that. You said they've helped your family through the years and through the decades, right?
That's correct. Yeah, I've seen him work with my father through some heart issues. He had became close with some of the doctors working in and out of cardiac rehab all those years, and just seeing how they take care of people.
Okay, what's your specialty? What are your day-to-day duties and tasks?
So I work with heart patients, whether it's in the clinic or at the hospital, trying to better their lifestyle, getting them to eat properly, increase their activity levels, manage your medications better, and try to live a stress-free or less stress lifestyle.
Mm-hmm. That's a lot there. I mean, there's a lot to go through there. Are there priorities? Are all of these things equally important for someone who's dealing with heart issues or trying to prevent them?
So in reality, they all are equal. However, it's on an individual basis. So if someone looks like they need a little more work on their diet, we work on that first and foremost. Some people just need to de-stress, and believe it or not, it trickles down from there.
Mm-hmm. What's the difference between a health coach and someone who might be a personal trainer or someone who might, work the therapy aspect of something with a patient?
So for health coaching, against, say, a personal trainer, this is more involved, it's more in-depth. We're really digging deep into all the facets using, national nutritional guidelines with, of course, their medications and what their doctors are prescribing for their care. Physical therapy side of it, we're not as involved with joints, getting their muscular structure back in order and things like that. So it's really just continuation of heart care.
Mm-hmm. So when you take on a patient, how does it work? How often do you meet? How long do you meet? What's the information that the patient needs to bring to the table for you to be able to help them?
So we meet based on what they're able to do. Everybody's different, schedules are different. So I leave it up to them. However, I do try to see them face-to-face as much as I possibly can. The things that I ask them to bring right away are a diet log of things that they've been eating up to a week. I tell them don't sugarcoat it, be as honest as possible, because that's where I start making adjustments, small adjustments. And, of course, over time it builds up bigger and bigger. And, of course, their activity log as well to see where they're at, what they like to do, what they don't like to do, and ways that we can actually get them more active throughout the day.
Okay, so you want to know everything a person eats. You want to know how active they are, whether they, that doesn't mean jog 5 miles a day, right? That's just taking a walk around the block or walking the dog or taking the steps instead of the elevator, right?
Right. Little things. Parking farther away from the store, Getting up during commercial breaks and just doing some exercises in your home can be effective.
So what are the most common things that you deal with? What are the most common things that patients can change to help their heart health?
The big one is time. A lot of people get in their heads that they don't have the time to work on their diet, work on their exercise. And a lot of it comes down to, family, work, what they're doing in their ins and outs of their day. But I promise everybody, and I really, really focus on this, that there are times that you can do these things. And even like I said with the diet, just little adjustments can make huge differences in your life.
Give us an example of that.
Okay, so a really good example is just decreasing the amount of sodium that you have in your diet. Sodium is in everything that we eat, really, unless you're buying it fresh. I mean, you go to a store, you read a label, it's in there. So what I tell people first and foremost is if you salt your food, stop doing that. Try to get rid of that. Just eat what's in there. And if you need to add a little bit for taste, add a little bit. Also learning to read the labels, the nutrition labels on their packages, so that they can see the amount of sodium in there and decrease from there. As Americans, and especially in West Virginia, that is really, really top priority for me because it's probably the worst out of everything that I see.
Really? So sodium is more dangerous or more, in terms of heart health, we're all kind of trained to avoid sugar as much as we can, sugar and flour and that type of thing. So for heart health, sodium's even more dangerous.
Yeah, it increases the amount of fluid that your body holds on to, which of course increases your blood pressure, increases your heart rate, makes your body work harder than it needs to.
Okay, so decrease sodium. What's next on that list?
Right then, I'll go for the cholesterol, decreasing your cholesterol, trying to stay under that 300 milligram a day limit. It's a little bit tough because a lot of people focus on one item at a time. But if you're eating 3, full meals a day, as most of us do, you want to make sure that all the foods added together per meal keep you around that number. So be about 100 milligrams per meal every day.
Okay, decrease salt, and let me guess, increase fruits and vegetables.
Absolutely, absolutely. Fiber's huge, and there's a lot of nutrients in fruits and vegetables. So, yeah, I get on a lot of patients about that we need to bump those up as much as we can.
Okay. Another issue that people have is smoking, and obviously it's difficult to do, but I'm sure near the top of the list is flat out get people to stop smoking. That's an obvious one, but what about smoking cessation? Can you help with that a little bit? Can you help coach people off the tobacco?
We do talk about it. I give them ideas and tools that they can use. The biggest one is talking them into going into a smoking cessation class. And just like, everything else with the sodium and cholesterol, is trying to talk them into decreasing the amount that they're doing it. Slow and steady wins the race. A lot of times I see people go cold turkey, and within a week or two, they're smoking the same amount, if not more, because their body just can't adjust to it. So it's easier to kind of taper off. But I always recommend a smoking cessation class. They're very helpful. Okay.
And those are available through Mon Health?
Yes.
Okay. Very good. What if someone's out there listening and they think, you can help me, Chris, you can help me out here, what would a consultation look like, and how would they get that started?
Okay, so to get the consultation, the biggest thing is to go to monhealth.com/heart, and there they can pull up the information, get with one of our cardiologists or exercise physiologists here. Once they come in, they can ask to see me. They come in, I set them up with the initial appointment, talk to them about what I do, how often we'd be able to do it, and some different options. It is covered by insurance, so that's another thing I tell a lot of people. And then just handing them the daily diet logs and exercise log to go through and fill those out to bring back to me at another appointment so we can really assess where they are and build the best plan that we can.
And there's a team approach to this, right, to heart health at Mon Health, and you're just part of that team.
Absolutely, absolutely. That's what I tell people. I'm a middleman between their doctors and their nurses and themselves. So my job is to continue their care and make sure that they get healthier and healthier, less likely to come in and have more medications, procedures done, and makes their doctors really happy.
All right, we are with Chris Hedio. He is a health coach for Mon Health Heart and Vascular Center. It is Heart Month. February is Heart Month, and we'll talk a little bit with Chris when we return after this break about some tips and tricks keeping that heart as healthy as we can. Stay with us. We'll continue with Mon Health Talk after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Chris Hedio is with us. He's a health coach, Mon Health Heart and Vascular Center, and February is Heart Month, right, Chris?
That's correct.
All right, so give us some tips on keeping that heart healthy. What can we do long term to stay healthy?
The one thing is you want to be as active as you feel that you can. So you want to build up to about 150 minutes of exercise a week. If you look at it in relative terms, that's 30 minutes a day for 5 days. I tell everybody build up over time, do it slow so that you're not just hammering yourself and tearing your body up, because then you're not going to feel like doing it. And also, you can break it up throughout the day. It doesn't have to be all at the same time. If you have 10 minutes in the morning before work, 10 minutes on your lunch break, and 10 minutes in the evening when you get home, that's perfectly fine. You can still get the benefits of exercise for your heart just in those time periods.
Okay, so exercise, diet, stop smoking. Those are probably the three biggest things. As a health coach, where's your role come in between you mentioned before you're kind of a go-between the doctors and the patients. So where do you see your role?
So when it comes to patient care, the doctors will tell you the basics, just like we've talked about, Dave, where it's increase your activity level, watch your diet. That's kind of tough for a lot of people. There's so much information out there. You get on the internet and you turn around and it's telling you something completely different. So I take the guesswork out of it from my end. I do the planning for the patient and help them build that healthy lifestyle, and they don't have to worry about it. All they have to do is just give it their best to try to follow the goals that we're setting for them.
That's a pretty good deal. I mean, you're right. A lot of people are confused as to what to do. You clear all that up if people can follow directions and, follow your direction specifically, then this can work out for them.
Right. And there's been tremendous success with a lot of patients. Like I said, the ball is in their court, but I am a great motivator. I'm their biggest cheerleader, and like I said, I take the guesswork out for them, make it really easy to do. Okay,
so when a patient comes to you, you sit down, you make goals, right? What would be typical goals for someone who starts the process by meeting with you?
Okay, the first thing is just to have them log everything. Get used to thinking about having that there, being accountable. So if we're going to do 15 minutes of activity starting out, 4 days a week, like I said, we build up slowly. Write it down, check mark it. I want to know. Same thing with your diet. If I just make a simple goal for the week of let's drink more water because you're filling your diet with sodas and things like that, check mark those goals. And we can be accountable with those during the week through email, or every time they come to an appointment, I look through it and see where they're at.
Okay. We've got a few minutes left in the program. Let's take a moment and kind of go through Mon Health's bona fides in terms of being a heart and vascular center that is much renowned facilities in the state. So Mon Health, first accredited hospital in West Virginia and the 24th in the country to receive the Heart Care Center National Distinction of Excellence. That's great. Also, Mon Health, West Virginia's first and only AFib accredited hospital. If you want to jump in and kind of explain what these things mean, go right ahead.
Yeah, so it's going by national standards of care. They come in, they look at everything that we're doing and break that down. Honestly, part of what they do with that is my program. We added that in to, move forward, especially with the AFib accreditation. And I got to tell you, knowing that all these are happening to us, that we're seeing all these, awards and credentials, really makes it awesome to be a part of the team.
Mm-hmm. Also, Mon Health, the first hospital in the region to offer Watchman for AFib treatment. What does that entail?
Okay, so what they do, it's a device where they go into your heart. You have a extra portion of your heart. It's called the left atrial appendage. And when you have atrial fibrillation and your heart doesn't pump quite the way that it should, blood can pool in there, and that's where the increased risk of stroke comes from. So what they do is they go in with this small device, they go into that area, and they deploy it, in essence blocking it off. And over time, tissue grows over that, and you get to come off of blood thinners. It's a fantastic procedure. I've recommended it to a lot of patients who hate their blood thinners, including my own father, who had it done just this past summer.
Okay, very interesting. Very, very interesting. Also, Mon Health Chest Pain Accredited Hospital for 9 years in a row. So, again, those are some of the bona fides, and I don't have to tell you, Chris, you work there, you know all about it. You work day to day with all of these fine people that their first priority is community health.
Yeah, absolutely. I would recommend any of our cardiologists, electrophysiologists, any of the doctors here. We have a fantastic group from the ground up.
Okay, how can people reach out to you to get this process started if they want to make an appointment and start with a health coach?
Like I said, they could go to monhealth.com/heart, or they could call here to our clinic. It's 304-599-8802, and just ask to speak with either the health coach or Chris Hedio.
Okay, 599-8802, the number for to reach Chris, his department, and Mon Health Heart and Vascular. Chris, again, we appreciate your time, and good luck to you. And again, folks that want to reach out, they can go to monhealth.com/heart or give them a call, 599-8802. Again, Chris, great information. We appreciate your time.
Yeah, thank you so much.
Chris Hedio, health coach for Mon Health Heart and Vascular Center, and it may be something that could be beneficial to you if you just reach out. It's as simple as that. That's Mon Health Talk for this Monday. Thanks for listening here on WAJR.